There's a lot of misinformation online about what therapy actually is and its benefits. So today, from a person who graduated with a degree in psychology, let's shed some light on some of this misinformation and debunking some of these myths. Number one, therapy doesn't actually work, and it's just a waste of time. A study published in the National Library of Medicine had a sample size of over 2,000 patients, and the study suggested that out of 2,000 patients, 69% reported feeling better after going to therapy. Here's what's important to note. There's another 30% of people who reported no change. They didn't feel better, they didn't feel any worse. In other words, 2/3 of people out of 2,000 who went to therapy reported feeling better. This is just one of numerous studies which depicts the effectiveness of treatment when it comes to psychotherapy, especially as we're becoming more advanced. We're learning about more theoretical models, and every decade that passes, we're learning more about the brain, and these studies are getting more and more effective. This leads me to myth number 2. Therapy is just talking. You just sit there and complain to somebody for an hour, and that's just going to make you even more depressed. Now, therapy is talking to a licensed professional. This could be a counselor, a psychiatrist, or a psychologist. Here's where it's different. The moment we say talking, we have this bias and we think, well, everybody talks. I talk to my mom, I talk to my dad, I talk to my teacher. How can talking be anything of value? But if I tell you I talked to my cardiologist, people are going to listen. Oh, wow, you talked to a doctor. Well, what did they say? And yet, when I use the same word talking to my therapist, people don't see any value in it. Consulting, talking to a financial advisor. Yes, you're talking to an expert. But talking to a therapist all of a sudden seems uneventful. A medical doctor studies for at least 11 years. So does a psychologist and a counselor for at least 6. No, question becomes, why should you go to a therapist when you can just speak to your friend, when you can speak to your family member? Think about this. Me and you are out, and we see somebody having chest pain. And right before you call 911, I say, no, hey, don't call 911. I got this. I'm not a doctor, I'm not a nurse, but I've seen some YouTube. Let's get him to drink some green tea. All right, it's probably just acid reflux. I'll take care of it. Now, what I just said sounded ridiculous and extremely dangerous because I'm not a doctor and I'm giving medical advice. And yet we do this all the time with mental health. People who are not psychologists, who are not counselors, are giving advice about ADHD, about social anxiety, about depression. Watch this video and never feel stressed again. This video will cure your depression. And we take those seriously. So you wouldn't listen to me if I say, don't call 911. Why? I'm not a doctor. But if you're in a bad mood, or if your mental health isn't doing well, you're going to take all my advice. But I'm not a psychologist. I'm not a counselor. And I sit you down and I go, hey, don't go to therapy and that nonsense. I got you. All right, here's what you're going to do. Ready? Don't think about it. Better yet, go hit the gym. What's crying going to do? Oh, you want to go complain to a therapist? No, don't complain. Go do something about it. We have people that are not licensed professionals confidently speaking on issues that they have not been trained in. Folks, that's dangerous. And I assure you that when we talk about complaining can increase depressive symptoms. Nerds would call this rumination or ruminating. I promise you that licensed professionals are very aware of rumination. And if all therapists did was you go over there, you vent for 50 minutes and then you left, folks, you wouldn't have to pay $150 an hour. You could vent to a wall. You could vent in a journal. You could vent to your friend. It's far more than just complaining to somebody. Myth number 3. Therapy is only for extremely rare cases. So I'll hear this on podcasts. People will say, look, therapy is great. If you go to Vietnam or Iraq and you fight and your leg gets blown off and you come back and you have PTSD and you try to hurt your wife, you should go to therapy. But no one else. It's like therapy can be for everybody, or counseling rather, could be for anybody. It could be for relationship problems. It could be facing loss, changes in identity, usually a big change in somebody's life, losing a job, moving to a new city, becoming a father, doing really poorly in school. Any of these could be sufficient to see a counselor. But what we've done historically is we wait until the problem gets catastrophically bad before we reach for help, right? So the girl doesn't go to her therapist when she's like, yeah, like I'm falling out of love with my boyfriend. They go to the therapist once she's been having an affair for 3 months. So like, think about that for a minute. You fell out of love, and then you thought about someone else, and then you messaged someone else, and then you met up with them not once, but multiple times. Well, why didn't you go earlier? And because of that, we have this narrative that something extreme has to happen for us to go to counseling. Folks, counseling doesn't mean we put you in a straitjacket. It doesn't mean you're crazy. It doesn't mean we lock you away and put you on medication. The truth of the matter is, some people need a little bit more assistance than others. Why not go to counseling if you need some extra assistance? Some people need tutors for math, some people don't. Some people need 1 hour of training in a certain sport. Some people need an hour and a half. They need to stay extra. They need to show up early. It's just how it is. Myth number 4, going to therapy means you're weak. All right, so listen to this. In life, I don't really do deadlifting. Deadlifting, bench press, I've usually stayed away. Why? Any of my friends that went into it got seriously hurt, shoulder injuries, lower back injuries, and they've even needed surgery. Because of that, any deadlifting or bench pressing or serious weightlifting I've done has been with really, really low weight. And if I was to do really heavy weightlifting, I would get a personal trainer first to make sure I'm doing it correctly, to educate myself, and to make sure I can lower the chances of me doing something stupid. Let me ask you something. Is me getting the advice of a licensed professional, does that make me weak? And if the answer is no, why do we look at people who go to therapy and call them weak? Are we not both going to a licensed professional who studied their area of expertise and we're getting advice? So if I get a personal trainer, people are going to go, good for you, Daniel. You might not need one, but you're thinking about prevention. You don't want to hurt yourself. You're trying to cover all of the dark areas. Very good forward thinking. And yet if we go to counseling, we're looked at as weak. We're looked at as dependent. You got to be strong. Why? What do you need a counselor for? Folks, you don't need a personal trainer to start deadlifting. Actually, I don't know of many of my friends who got personal trainers who went into deadlifting or really heavy bench press or any sort of weightlifting in general. But don't you think speaking with that professional would be beneficial? Could decrease the chances of harm in the future? And with that, I have addressed some of the most common myths when it comes to therapy or counseling. Did I leave anything out? Are there any others that you think about? If there are, please let me know. Send me a message, comment. I'd love to read it. Take care, everybody. Stay safe. Bye-bye.